wash my hands, check the doctor's order. Doctor's order says for trach suction, and then I'm going to walk into the patient's room, wash my hands, introduce myself. Hi, my name's Chris. I'm a student nurse at Dewville. Today I'll be suctioning your trach. I'm going to check to make sure it's the right patient, and it matches the MAR, right patient, Buffalo Bill. I'm going to explain to the patient what I'm doing, so I'll be suctioning your trach. This is going to help you breathe a little better if there's any secretions in there. I am going to assess the patient's respiratory rate. I'm going to assess rate, rhythm, effort, noise, depth. I'm going to check SpO2, make sure it's within normal limits, check for orthopnea, check the color of the patient's skin, and then I'm going to put on gloves and make sure that the suction works. And for a wall suction, it should be about 80 to 120, and if it's a portable suction, about 10 to 15. I'm going to turn on the suction. And make sure the suction works. It works. I'm going to drape the suction into the patient. I'm going to take these gloves off and wash my hands. I'm going to instruct the patient that before I should suction, the patient is going to take a couple deep breaths in and out. He'll do that between both times that I suction. You can't suction more than twice. You got to wait about 60 seconds in between each suction. So I wash my hands. I'm now going to open my gloves. Sterility. I'm going to keep my hands above my waist at all times. To use my saline, open that, and put it on my package from the gloves. I'm going to pull out the catheter. And then wrap that in my dominant hand. Next, I will turn on the suction. And this hand now is unsterile. I will attach this to here, make sure that this works. By including it, I am going to lubricate the catheter. Wrap it in my hand. I am going to move the trach collar and tell the patient to take a deep breath in and out for me. And I will go in until I feel resistance, so the patient starts coughing without occluding. And then in circular motion, start occluding no longer than 10 seconds. Right foot back in my hand. Put the oxygen back on and wait about 60 seconds in between suctioning. I will flush my suction. Rewrap that back in my hand. Now that it's been about 60 seconds, I will tell the patient to take another deep breath, and I'll move the trach collar. And go in until I feel resistance, and start occluding. Wrap that back up in my hand, and put that back over. You cannot suction more than twice. I will shut off the suction, put the suction back. I will take off the gloves. I will wash my hands. At this point, I will see if the patient, check his breathing again, rate, rhythm, effort, depth, make sure SpO2 is good, check the color, orthopnea, and I'm going to document any secretions that I found. So it could be like thin or thick secretions, green, document the color, the consistency, and then ask the patient if they need anything else, and I would be all set.